We are discussing about recurrent pregnancy loss almost every day nowadays. When a woman has two subsequent pregnancy loss at any gestation, it is known as recurrent pregnancy loss. Once a recurrent pregnancy loss is diagnosed, the couple needs to go through a lot of tests, some of which are very special and needs to be done in special laboratories to find out the reason. We know we can only find out the reason in 70% of the cases. 30% of the recurrent pregnancy losses are undefined, or we cannot find a definite reason. But still, we should be positive. And as a doctor, I always ask my patients to be very positive, because we know that even after two losses, the third pregnancy can be a very non-eventful pregnancy and can lead to a very healthy baby. So both the couple should be very positive and come to the doctor and do the tests and try to find out what is the reason. We as doctors are very conscious and try to carry on the third pregnancy with a lot of care and tender love for both the couple as well as the family. Recurrent early miscarriages are miscarriages in the first trimester, that is, prior to 12 weeks of gestation. In these cases, the embryo has received mostly abnormal number of chromosomes. So chromosomal abnormality is the commonest cause. But also in these cases, we should do a very important 3D ultrasound for the uterus to find out whether there are any uterine abnormalities also. Sometimes there are a little bit of hormonal changes like subclinical hypothyroidism or borderline high sugars, which can cause these miscarriages. So a proper counseling prior to conception and a detailed history taking in these cases helps us doctors to find out the cause and easily rectify it. But if it is a genetic cause like chromosomal abnormalities, sometimes again the couple has to go through some special tests. Recurrent late miscarriages, that is miscarriages in the second and third trimester, are commonly caused by many autoimmune diseases, uterine abnormalities, incompetent cervix, which can lead to premature births. These need to be evaluated in details, and the patient needs to undergo a lot of tests, especially prior to conception, like tests for autoimmune diseases, a common syndrome known as antiphospholipid antibody syndrome, which some of you may have heard is a very common cause of this sort of deaths. Sometimes the late miscarriages are also caused by medical problems like already discussed excess sugar levels in the body of the mother, or any other medical complications like hypertension or pregnancy-induced hypertension. And there is a very severe condition sometimes which happens and causes late miscarriages, like separation of the placenta due to many medical causes, and which can again be recurrent in the later pregnancy at a very high rate. So these are patients for which we are extra careful, and they also need to understand their medical problems and go through the next pregnancy just as the doctor has advised.